Well, welcome everyone. Thank you for joining us for this session of the Connecticut Affordable Housing Conference. I'm Samaila Dilaye, Research and Policy Fellow here at the Partnership, and I'm assisted today by Chelsea Ross, our Executive Director. So this session is entitled Rental Assistance, Exploring the Impact and Future of Federal and State Programs. Thank you to our sponsor for this session, Preservation of Affordable Housing. And thank you to all.
All right, so we should get going with this. My name is Matt LeBeau from the Connecticut Department of Housing. I previously worked with the Unite CT program and then the Eviction Prevention Fund. Now I'm currently working on our new Eviction Prevention Fund programming through Department of Housing. And I want to introduce the panelists, and I'll leave it to them to introduce themselves, but we can start off with Danya Keene, doctor.
Okay. Am I introducing myself or am I presenting now?
Introduce.
Oh, just introduce. Okay.
Yeah.
Hi, everyone. My name is Danya Keene. I am a researcher at the Yale School of Public Health, and where I direct a research group called the Housing and Health Equity Lab. And I'm just so grateful to the organizers of this panel and this whole conference. It's such an important event and glad to be here. Thank you.
Maya, I think you're up next, doctor.
Hi, I'm Samaila Dilaye again. I'm a Research and Policy Fellow here at the Partnership for Strong Communities.
And now we have Urvi.
Thanks, Matt. Hey, everyone. I'm Urvi Patel. I use she, her pronouns. I'm a policy analyst on the Housing and Income Security team at the Center on Budget and Policy Priorities, where I mostly work on state-funded rental assistance.
And close things out, James.
I'm Jim Riccio. I'm a longtime researcher at MDRC, and I've been co-leading with several colleagues here a direct rental assistance project, which I'll talk about when it's my turn.
Dr. Keene, I think you're up for your presentation.
Okay. I'm up. Samaila, you have my slides, right?
And just a little bit of housekeeping as we're going along. We're going to do our presentations, and if you guys want to put questions in the chat, we can try to come back to them once we've all done the presentation. So, Dr. Keene, all yours.
Okay, so I am going to just talk for a few minutes about how rental assistance can affect health. In my lab, we really focus on understanding how we can leverage housing policy to advance racial health equity, and how we can leverage health data to support more equitable housing policies. So rental assistance is one of those policies that we're thinking about. You can go to the next slide. And one thing that really motivates the work in our lab is the serious unmet need for affordable rental housing in this country and here in Connecticut, which I'm guessing is not news to anyone who's been at this conference today or who lives in Connecticut. But just to start with a number, these are data from the National Low Income Housing Coalition, which indicate that in Connecticut, you would have to work 88 hours per week at minimum wage to affordably rent a 2-bedroom market rate apartment. Next slide. And so this lack of affordable housing creates many forms of housing insecurity that all affect health. Lack of affordable housing contributes to cost burdens when people are spending too much on housing, often at the expense of other needs like food or medication. Also contributes to eviction when renters who are paying too much for rent inevitably fall behind. Contributes to poor housing conditions when tenants have to settle for lower quality housing, or they're limited in their ability to advocate for better housing conditions because the market is so tight and they're worried about having nowhere else to go. And in our work, we're really thinking about how all of these dimensions of housing insecurity affect health through all sorts of mechanisms, including just the extraordinary amount of stress that's associated with all these forms of housing insecurity, and it's just really toxic to the body and keeps people up at night. Next slide. Okay, so in our lab, we're thinking about rental assistance as an intervention that can alleviate housing insecurity and improve health. And many of our studies have focused on rental subsidies, HUD rental subsidies, which reduce a tenant's rent to 30% of their income, and therefore guarantee that housing is affordable, at least according to official definitions of affordability. And these subsidies come in two general categories: project-based assistance, where the unit itself is subsidized, and tenant-based assistance, where the tenant receives a voucher that they can apply to a unit of their choice, or at least a unit where they can find where the landlord will accept that voucher. And you can go to the next slide. And so one key fact about rental subsidies, these HUD rental subsidies, is their scarcity. Fewer than 1 in 4 income eligible households receive them, and often after long waits. Nationally, there are about 13 million eligible and unassisted households. And I serve on the board of the Housing Authority here in New Haven, and we have about 30,000 households on our list. Next slide. In these long waiting lists, they certainly create an opportunity for where we could do better and create more investments in housing. They also create a kind of natural experiment. We can compare people who are receiving these subsidies to those who are waiting for subsidies. And when we compare these two groups who are very similar, other than the fact that we have the scarcity, we can really prove how harmful it is not to have adequate access to housing. And we can also show how much we could improve health if we expanded these programs to meet the existing need. And one way that we've compared these two groups is by linking national HUD data, the administrative data, to national health surveys. And when we do this, we can create these two groups of individuals. One group who received the rental assistance at the time that they were surveyed and their health data were collected. And then there's a second group who received the rental assistance 2 years after the survey data were collected. And we know this because we can look longitudinally across the HUD data. So that's our control group. Next slide. And when we compare these two groups, and not just us, but our colleagues at other institutions have compared these two groups, the rent-assisted group and this control group, we find significant benefits of rental assistance across many health outcomes. Together, these studies find that rental assistance improves food security, increases fruit and vegetable consumption, it reduces the risk of uncontrolled diabetes, improves self-rated health, improves outcomes for childhood asthma. Rental assistance also reduces the number of school days that children miss and reduces crowding for households with children. And these papers on the right are just a few examples from our lab that document these findings. Next slide. So that's a summary of the national studies we've done that have looked at rental assistance and shown these huge health benefits associated with these subsidies. I just want to, in the last 60 seconds, just say a bit about some other work that we've done in Connecticut looking at rental assistance. So in one study, we interviewed 30 people who were on waiting lists about what it was like to manage their health while waiting for these subsidies. And we interviewed them 4 times over 3 years to look at how things changed for them over time, and especially when they got off waiting lists, what changed for them in terms of their health. We also did a survey where we followed 113 individuals who have type 2 diabetes and were on waiting lists, and we collected all sorts of health data from them and surveys. And again, we looked at how their health changed over time, and many of them did get off waiting lists and transitioned into rent-assisted housing, and we can look at those health changes. And then, different from these long-term subsidies, during the few years in about, I think it was 2022, we interviewed 60 individuals from Bridgeport, Connecticut and Columbus, Ohio, about their experiences with emergency rental assistance, which was available during the pandemic. And I'm happy to say something about any of those studies in the Q&A. And now I think that's it. That's all I have. So I will turn it back to our moderator there. Oh, I have thank you to all my wonderful colleagues and all the sources of funding for this work. And students, wonderful students too.
Dr. Samaya, I think you're up. And just a quick thing before we do that, I know Dr. Keene has a cut at 2:30, so we'll do questions for Dr. Keene first when we get to the question and answer section of this piece of the conference.
So I'm going to be sharing some of the work we've done on RAP. This is part of some of the findings from a report we published earlier this year. I'll share the report later in the chat. And so, like Dr. King just said, there are like many benefits to rental assistance. And for us, beyond just health, there's like the poverty angle, family security, child development and well-being, just access to affordable housing itself. And here in Connecticut, we have the state-funded rental assistance program. And we all know about Section 8 and how it's helped many families. One of the major tools the federal government uses to subsidize homes for people. However, here in Connecticut, we have RAP, which eligible families, those who make 50% of AMI or less. And there are about 6,500 of those vouchers in circulation. So families who are supported through this program pay 40% of their income on housing costs. For those who are elderly or living with physical disabilities, about 30% of income. So the program kind of like targets some of the most vulnerable populations. So people struggling with homelessness, people living with disabilities, etc. And we wanted to look at what expansion of this program might look like. Universal expansion, meaning expanding to all those who are eligible, who fall within the income bracket. 10% expansion means just increasing the number of people who are being supported. Moving to 2020 peak levels, which was I think one of the highest levels we saw in the number of people who were being supported through the program. And then how much it would take to maintain current levels, so supporting the same number of people. And this was based on the end of the 2024 fiscal year. So for our data sources, we kind of use a number of sources to get the data together, from the Comprehensive Housing Affordability Strategy, which is put together by HUD, which sort of looks at housing cost burden, but also divides it by income bracket based on AMI, etc. So that helped us better estimate. We got data from the Department of Housing on the voucher programs and the cost of the subsidy for each. And of course, the ACS, just to get an idea of housing costs with a more current data release. Now, what we came to find was that there are a few things that guided our estimations. And so for one was what the average, monthly change in general RAP subsidy was for the general RAP subsidy, but also for the more specialized programs as well. How much the cost was at that time. So the end June of 2024, what the cost was for each supported household on average, what the administrative cost was, the number of active vouchers at the time, which was 6,494. How much was the funding for the program at that time? And then estimating how many people were cost burdened that fell within the income bracket. That's 50% of AMI or less, based on where they were living. And also looking at the number of the change from 2021 to 2023, and like how many more families or households were cost burdened. And so that helped us kind of like estimate the number of people who would need support, who will be eligible and not getting the support they need. So we estimated that about 176,728 households were eligible for CT RAP, but were not supported. And that achieving funding to support all of these households will come to about 2.4 billion to 2.46 billion dollars, which is over 3,000 more than what we currently have supporting the program. So I want to think about that in terms of like for the families that are eligible, who are not currently being supported, they would need to come up with this amount of money, or the government needs to come up with this amount of money to make their housing affordable. So Then we also found that to expand the program to its peak in December 2020, there will need to be 80 more vouchers compared to June of 2024, and that will cost about $1.1 million, increasing the program's budget by 1.4%. Expanding RAP by 10% will cover 649 more vouchers. So this again is based on the June 2024 estimate, and this will come to about $9 million increase. To maintain the levels in June of 2024, there will need to be another 13 million increase in how. And so this is what it looks like, how much will be required and how much is there. And you can see that with universal expansion, it comes to about $2.5 billion. For an expansion of 10% comes to about 99.5 million. Expansion to meet 2020 peaks 91.56, and then maintaining the number of vouchers about 90 million. And so thanks. And if you have any questions about this or how we came about this estimate, we'll be happy to explain later. Thank you.
Irvi, your presentation.
Thanks, Matt. And Samila, if you could bring up the presentation, that'd be great. Irvi, she, her pronouns. As a reminder, I work at the Center on Budget and Policy Priorities, which we're a DC-based policy organization, though I'm tuning in from Virginia, where I'm from. And so I'm grateful to be here in this space with you all. The center's work, we focus on protecting and expanding economic security programs, including rental assistance, by advancing both federal and state policies. And so I want to be as helpful as possible by providing a bird's eye view of what we've learned about state rental assistance programs across the country and just some emerging themes about revenue. And I'll do my best to tie in what Danya has already said and what Samila has presented on. So if we go to the next slide, we understand that federal rental assistance is designed to meet the gap between people's incomes and the cost of rent. And we also know it's one of the most effective tools we have to keep people stably housed. Research has shown that it reduces homelessness, improves long-term health and educational outcomes, again, as Danya mentioned, and it really keeps families together. You can see that the reality is that federal rental assistance is deeply underfunded and can be quite challenging to navigate. And because of this, we know that wait lists are long and people are left out, including 3 out of 4 renters in need of a voucher but don't receive it. And so that's nearly 18 million people, including people with disabilities, seniors, adults with low incomes, caregivers, and so many more. And there is an interactive version of this chart, so I'm going to link it in the chat for you all to take a look at. But on the next slide, you'll see recent examples of how in this moment, states are really at an inflection point. Rents are high, having increased significantly over the years, and people's incomes just haven't kept pace. And on top of that, federal housing and homelessness programs are facing deep cuts, funding cliffs, and a lot more uncertainty than it has in the past, some of which we've seen just in the past few days. We also know this is felt most by states and localities, especially in Connecticut, where housing authorities are finding it harder to maintain their existing voucher commitments. Homelessness assistance programs are facing reduced funding despite increased caseloads, and communities are seeing higher demand for crisis services, which are of course impacted when people can't afford their home. And so while states didn't create this drastic federal shortfall, they are definitely feeling its consequences, which is why state investments in rental assistance and other housing and homelessness supports are particularly important right now. And so on this slide, you can see that we did an analysis of state rental assistance programs across the country. And we found that many states do invest in subsidies for people with low incomes. And you can see that across 35 states and DC, there are over 100 programs and growing. Most of these are tenant-based rental assistance programs, and most of them are time limited, though some do provide one-time supports or ongoing assistance. In terms of reach, most programs are candidly small compared to the federal program, but a handful, including Connecticut's and Massachusetts, DC, New Jersey, and most recently Minnesota and New York, they go the furthest in terms of closely modeling the federal program and also just reaching a broader group of people with low incomes. And so just a little bit more about these handful of programs that model the federal program. Massachusetts actually established their program before the federal housing choice voucher and served as the model for it. New Jersey has the biggest state rental assistance program focusing on people with housing instability. And Connecticut's state rental assistance program funds vouchers that can be used anywhere in the state, making it easier for people to find housing, which is different than federal vouchers, which can only be used in the locality that they're issued. DC also has a continuum of rental assistance, including an ongoing emergency program that goes beyond just the pandemic relief program. Minnesota's program was created just last year, and it's funded by state appropriations and a new sales tax. And New York's rental assistance program was just funded this year in the state's budget. And we find that state programs are really beneficial in a number of ways, again, including how my peers have talked about what's going on in Connecticut. They can help states meet specific policy goals. They complement efforts to increase supply by making sure that housing can be accessed by people with the lowest incomes that are often left out. And they really present this unique opportunity to design a program that avoids some of the challenges with the federal program. This includes including people with lived experiences in the design and implementation, streamlining applications, aligning systems with homelessness providers, testing direct rental assistance, and extending support to people left behind from federal programs. For example, both the programs in Massachusetts and New Jersey don't exclude people based on immigration status. And with that, we're learning more and more about states that are working on or creating rental assistance programs in response to federal cuts. So there is growing momentum in this space. And so the next slide shows a little bit of a glimpse into the theory of change that we are thinking of in terms of meeting the moment. Right now, the politics of scarcity that is happening at the federal level is spanning across multiple programs: rental assistance, food assistance, health coverage, and so on. And while it's easier said than done, there really is this unique opportunity for states to not buy into this scarcity politics, but instead meet state needs and put pressure on federal leaders at the same time. Connecticut and other states face this strategic question around how to build sustainable and equitable economic security systems, including a rental assistance system, which requires not just a creative way of thinking, but reliable state revenue. As Samaila mentioned, the cost of vouchers and the cost to make sure that everyone in the state is stably housed requires ongoing equitable forms of revenue. And we know this is important because rental assistance is most effective when it's long-term, and that of course requires long-term funding. And federal programs, the housing choice voucher, it's shown us the consequences of not having enough. And so every state is different, but we're seeing a lot of momentum around revenue for housing, including dedicated revenue streams for housing trust funds, real estate transfer taxes, including mansion taxes dedicated to housing and homelessness programs, and general fund commitments for housing that are treated as a core part of state spending and not just discretionary spending. All of that to say that federal uncertainty doesn't necessarily have to mean instability at the state and local level. And many states, including Connecticut and the ones that I mentioned that have these model programs, because they have such strong models, there is momentum to continue to build off of that and exemplify that for other states as well. I'll end with that just to keep it brief, but definitely happy to answer any questions around the state rental assistance program analysis during our discussion later. And just a very, very small plug that there is a federal housing roundtable happening tomorrow morning where Peggy Bailey from the Center on Budget will be speaking at, along with other leaders in the housing space. I can pass it back to you, Matt.
Thanks, Harvey. Jim, you're up.
Okay. Okay, I'm going to talk about direct rental assistance, and I work at, as I said, at MDRC, which is a not-for-profit, nonpartisan social policy research organization headquartered in New York City, although we have some offices elsewhere as well. So to start off, what exactly is direct rental assistance? The main idea, as many of you may be familiar with it, is that it's an alternative to the traditional tenant-based housing choice voucher approach, where housing authorities engage in a contract with landlords and pay the housing subsidy directly to the landlord. Under direct rental assistance, the main idea is that the housing subsidy would be paid directly to the households. The PHA would have no contract with the landlords, and all of the rent would be paid to the landlord directly by the tenant. And this is the number of DRA models being developed, but this is the feature that's common to all of them. It doesn't necessarily change other features, other responsibilities of PHAs. They would still determine eligibility for subsidies and conduct research and so on. But it's a very different way of getting subsidies to the tenants. And the inspiration for this was really to tackle the problem that's encountered nationally, which is that the lease-up success rate in many localities around the country is lower than would be desired. I think the national estimate's around 60%. So that means that there are many families who are issued a voucher, try to use it in the rental market, and are not able to get a landlord to accept their voucher. So they have to turn it in, and it gets provided to another family which may have a similar difficult experience. And the lease up rates for those, or the time frame to leasing up for those who are able to lease up, can be quite a while, can take months and months. So a goal of DRA is to try to improve the lease-up success rate by reducing a number of the bureaucratic barriers that may discourage landlords from renting to voucher recipients. The goals are also to reduce the burden and costs on PHAs and families, as well as on landlords, and to give families more choice over their housing options and allow them the opportunity to weigh pros and cons of taking a particular home in a particular location with a particular landlord. But it's also hope that this strategy may allow tenants with vouchers or with subsidies to be more competitive with unsubsidized tenants in higher opportunity areas, and so improve the access of those families to higher opportunity areas. MDRC has led over the last year or so a collaboration with 11 housing agencies across the countries and with other experts to design a particular DRA model. And several PHAs in Connecticut, the Department of Housing, at the state level, the Norwalk Housing Authority, New Haven Housing Authority have all been part of this collaboration, along with PHAs from Baltimore, Denver, Dallas, King County, and Washington, New York City, Oakland, and Santa Clara. And together, we've produced a model that has several core features that all of the housing authorities have embraced, but does also include some local variation, some options for doing things a little bit differently in particular areas. So I'm going to describe very quickly the core features of the model we've come up with. As I mentioned, central to the model is paying the subsidy directly to the tenant rather than to the landlord, and really severing the contractual relationship between the PHA and the landlord. At the same time, the model calls for periodic verification of the payment, meaning that the PHA would verify that the tenants actually use their subsidy to pay the rent. So this is very different from a regular basic income program, for example, where there's no check on how families receiving these monies use the money. Here, the money is intended to be used for rent and utilities, and so the PHAs would have to verify that it is used in that way. A second change in this particular model is in the way the subsidy would be determined. So under this model, the subsidy would be fixed at the payment standard minus 30% of income, which is the typical HUD rule, or 40% for the RAP program. And it would remain the same even if tenants found a unit that rented for below the payment standard. And if they did find such a unit, unlike in the regular voucher program, the tenant share of the rent, not the PHA subsidy, would be reduced. So tenants could actually end up paying less than 30%. And this creates a kind of shopping incentive for them to look for more affordable housing, which may be important because the policy also calls for dropping the rent reasonableness calculation, whereby PHAs have to make an assessment of a particular unit's asking rent is appropriate for what it offers in the local housing market, which many PHAs don't think has a lot of credibility and is a burden to both them and to tenants and to the landlords. And the policy would also get rid of the 40% affordability cap, meaning that tenants now under the voucher program are not allowed to rent a unit that would cost more than 40% of their adjusted income. By eliminating that cap, it gives families the opportunity to decide whether paying a little more might get them into a unit that brings important advantages for their family. So no cap would be set. And finally, an important change involves PHA inspections. Under this model, there'd be no inspections, either pre-move or post-move, conducted by the PHA. The tenants would be educated at the time of enrollment and provided with a checklist, given some guidance, but it would really be up to them to assess the housing quality of the unit they're considering. In some of the PHAs that we're working with, they're likely to opt for conducting some post-move inspections. But the Connecticut PHAs have decided that they'd like to forego those inspections entirely. And if tenants, after they move in, do run into problems, they'd be expected to make use of other resources available to any tenant in Connecticut or in their locality to try to get the problem remedied, whether it's with the health department or a local building department. There are other avenues that they could follow, just as non-subsidized tenants would follow, in order to get a housing conditions problem remedied. So that's the basic model. There are pros and cons to this. So it's important to put this model to a careful test. And right now, where we stand with this demonstration project is that we've drafted a policy design paper and a research design paper that outlines in more detail than what I've just provided what exactly the policy would be and how it might vary across PHAs. But also how we would evaluate it. And we're now starting to collect feedback on these papers. With funding from the Melville Charitable Trust and the Connecticut Project, we're now able to launch a DRA test in Connecticut with the 3 PHAs I mentioned. This will be a small pilot study, but an important pilot study serving about 50 families, and we expect to begin enrollment in the first quarter of 2026. It'll be a process and outcomes evaluation study, so we'll understand how the experiences of the housing authorities, the tenants themselves in the field, and some reactions from landlords. It won't be a randomized controlled trial, so we won't have a control group, but I think we're going to learn a lot that is very important and valuable about this particular approach. And the PHAs we're working with are now preparing operations manual to figure out how we'll take this general concept and put it into practice in their jurisdictions. With some of the other PHAs in our collaboration, we are preparing for a multi-site randomized control trial, which would give us a chance to do a head-to-head test of DRA versus the regular voucher program. And we hope to be able to launch that in 2027. However, I should add that whether we can actually achieve this is going to depend on the availability of voucher funding. Around that time. There's so many uncertainties at the moment about what resources the PHAs are going to have to fund vouchers. And if they're not in a position to issue new vouchers to families, when turnover vouchers become available, we may have to curb our ambition here. But we're going to proceed as though we can do that kind of randomized trial in at least 5 of the other agencies, which are MTW agencies. But we also have several agencies that are not moving to work agencies. And we're now in the process of looking for funding to try to include them in an evaluation. And it could be that they end up joining Connecticut-style evaluation, an outcomes and implementation study, rather than our RCT, unless we get very fortunate in being able to raise money for subsidies from those locations, which we expect is going to be a challenge. I should back up and say that with the MTW agencies, other than in Connecticut, the other MTW agencies, the HUD is allowing these agencies to use some of their regular voucher funding to pay subsidies in cash. So we don't need to raise subsidy money for those particular agencies. And with that, I'm going to stop, but happy to answer any questions.
Jim, we have a few questions in the chat. I mean, one's a point about New Haven residents should report issues to the Livable City Initiative Department, which I think Jared is a part of. And then you have a few questions about the PHA and the structure. Could you please address how and whether the PHA policies and who is a resident under this model? And then second question from Karen, if a CT PHA wanted to adopt some aspect of this model, where do they go for oversight approval and who greenlights the model?
Okay, well, on the second one, we've been working with New Haven, Norwalk, and the state, and so those agencies and their boards, of course, have had to agree to be part of this project. So we've been working with them and now their staff to try to figure out what this will actually look like in those communities. But if you want more information and may want to get involved somehow, you can certainly get in touch with me, and I'd be happy to figure out if there's a way forward there. And could you repeat the first question? I'm sorry, Matt.
Can you please address how and whether the PHA policies, who is a resident in the rental under this model?
So we tried to mirror in many other respects, except how we're handling the payment, the normal HCV and RAP policies. So people who would be eligible for RAP or for HCV would be eligible for this policy as well.
I think I might have made a mistake here. I think it's who polices, reading that quick. So who polices a resident under the rental under this model?
Okay, so the subsidy would be paid by the PHA to the tenant, but as I mentioned, the tenant has to provide verification that the family has in fact paid its rent. And we're working with the 3 PHAs now to figure out exactly what that process will be. But it'll be something along the lines of each month, tenants will make their payment and they will need to keep some sort of documentation, either a receipt from the landlord or cancel check or, a venue statement or something that indicates that they have made their payment. And the expectation is that they will have to keep those records for every month over the course of the year. And the PHA will come looking for that evidence probably 3 times a year or so. So they'd have to demonstrate that, in fact, they made the payments. And if they have not made the payments, then they'd be terminated from the program.
So this is a question for all. What real-time data do we not have today that would fundamentally change how we design and manage rental assistance? How do we move from reporting outputs, households served, dollars spent, to insights about long-term outcomes, mobility, income growth, reduced hospitalizations?
Yeah, I think this is a great question. I'm especially drawn to the second part of it, which I can speak to from my perspective. Just having a little bit of a bird's eye view. One, I think those long-term outputs are the outputs we should be focusing on, right? Like what gets families out of poverty? How does this affect people's long-term health outcomes, educational outcomes, just overall their well-being? And something that I've been really thinking about, we at the center, we support advocates that are working on getting alignment in their state for creating or expanding rental assistance programs. And when we think about what will speak to their policymakers, what will speak to their decision makers around the need to increase state investments or local investments into programs like rental assistance, some of the things that come up is, families with children is something that everyone can back and understand the importance for, especially around child well-being, around child welfare outcomes. And so, that's top of mind for me. So data around the relationship between rental assistance, whether it's direct rental assistance or vouchers, the traditional way, is how does that continue to improve the well-being of children's long-term outcomes, in addition to child welfare outcomes.
Yeah. And I can say in response to the second question as well, that in the study that we do, we want to understand the actual lease-up success rate of families, the length of time it takes to lease up, but also after they lease up, what is their experience? We want to understand the conditions of the apartments that they end up leasing, something about the neighborhoods they lease in, and how they're adjusting. If we have or in those locations where we have a randomized trial and we can do a head-to-head test with the regular voucher program, we can assess whether, in fact, DRA has led to leasing up in better quality neighborhoods or not, higher opportunity neighborhoods or lower opportunity neighborhoods. In apartments that have better conditions or worse conditions, which is a risk. But we'd also want to assess what trade-offs people make in that decision, and whether they, for example, choose to live in an apartment that may have more quality issues in order to be closer to work or closer to their family or closer to their child's school. So we want to try to take a deeper dive and understand just what the trade-offs are. So we certainly do and will collect information that goes beyond just the basic reporting that you mentioned here, household served and dollars spent and so on, to try to understand what are the real implications of the choices families are making for themselves and their families.
I'll just add in response to the first question about what data we don't have, like from the health side. I think, one of the things about all these health benefits that we see of rental assistance programs is many of them are concentrated in the project-based assistance. We don't see the same health benefits for vouchers, which I think the DRA is a really promising, but maybe a potential way to mitigate some of those challenges that we're seeing with the vouchers. I think like the data that we're missing is why, I think the answer is probably not going to be that we get rid of all tenant-based assistance and move to project-based assistance. It's not feasible. And so we really need to understand why as a health person, why we're not seeing these same health benefits from the vouchers. We have a lot of hypotheses, but we don't have a lot of data explaining it. And I think it'll be interesting to see how the DRA data can contribute. And I know I've been following the DRA program in Philly, or I guess it's a DRA program. It's the PHL Plus, which is providing the subsidy to the tenant. With no verification of how they spend it. And they're seeing some really positive outcomes in terms of prevention of homelessness and increases in housing stability. One place where the traditional voucher seems to perform a little bit better than the cash payment is on housing quality, but they still see benefits in housing quality for recipients of the cash. And that is a randomized control trial. So it's a small number of households, but I think it shows some real promising opportunities.
Maybe at this point, are there any additional research findings on the impact of rental assistance that you think more people should be aware of? And maybe Dr. Keene, you want to lead off on that? If there's any questions specifically to Dr. Keene?
Any additional research on the benefits of rental assistance? Question?
Just maybe part of your research in general, or things that you want to talk about before our panel comes to a close.
Yeah, I think I'll just echo what I said. Is that I'm very curious about why we we're not seeing the same health benefits for the vouchers as, and I think part of the reason. I think some of my hypotheses are about stability. They're about having the ability to advocate for conditions that tenants sometimes have in a project-based unit that they don't have with a private landlord, where there's such concerns about eviction. But I think, yeah, those are some questions that I have. And we do have a lot of qualitative data, I will say, in our research that just talk about how hard it is to be on these waiting lists and just the psychological burden of waiting. We have a student who has finishing up a paper that just really tells the story of what it's like to be waiting for these resources and navigating, checking with the housing authority, not knowing when your turn might come up, and just how hard that is. And I'm sure that takes a health toll.
About our other panelists, any other research that you guys think we should be made aware of as we're discussing this?
I could mention a couple of other things we've been involved in. With HUD, we have tested alternative rent policies for the voucher program. So not like DRA, but changing some of the core features of the rent rules. And part of the motivation behind those studies, one of it's called the rent reform demonstration, and a subsequent one, which is underway now, is called the stepped and tiered rent demonstration. So those policies include testing things like extending the annual recertification period from 1 year to 3 year to try to create more of a financial incentive for families to work, or reduce what many see as a financial disincentive built into the rent rules. Because as you know, as soon as someone's income goes up, if they were to get a job, their rent subsidy will go down. And so there's been a lot of calls over the years for modifying that kind of a policy to allow tenants to keep more of the income that they earn. So we conducted one test of that in a big randomized trial in 4 PHAs around the country. And a core feature of that particular model was, as I said, extending the recertification period. There's a subsequent study, the stepped and tiered rent demonstration, which combines a test among 5 PHAs of a stepped rent policy with an attempt to decouple the rent increases from people's changes in earnings, except where a hardship might be involved. And with another 5 PHAs, a modified version of this change in the recertification period, and one that also uses something called income tiers to set rent. So that one is underway. We have an initial report, but it's also a randomized trial, and in the coming years, we'll actually see some impact findings. So those are two areas in which there's a growing body of evidence. And I'd also say that we've done a number of studies, again, randomized trials, testing the Family Self-Sufficiency Program as part of FSS, both in New York City and nationally, and with a special test of another kind of self-sufficiency program that involves a different way of approaching the coach and tenant relationship that focuses more on executive functioning skills. And that test is, well, the intervention's completed. It's called My Goals. And that test has been carried out in Baltimore and Houston housing authorities. So there'll be more evidence on that coming along shortly. And if you get in touch with me, I'd be happy to share this information in more detail with anyone who's interested.
Do we have any final questions for Dr. Keene? If there's anything, I know that they have a cut that they have to get to, so just want to provide that last opportunity for our panelists and for our participants. Okay, so maybe not. And I apologize, I'm in and out of the cloud, so I keep going darker then lighter on my screen. But I guess that's the beauty of working in a cloudy or sunny environment. Maybe we'll get back to that question about other research that you guys are doing as part of our panelists that the participants should be made aware of, that you guys are thinking about, and then maybe we can close things out with how we can replicate other programs that are being done across the country or in the regions that you're seeing that we might be able to put in place here in Connecticut.
Yeah, I think I will kind of like speak to that question, but also in a way kind of respond to the question around like data we have and don't have and how that might affect how rental assistance is designed. And I think one area that I kind of like baffles me or takes my time in terms of like thinking from a research point of view, but also from a policy side, is that we really don't know we don't have data to tell us what's going on with people and families before they get on the waiting list. So the waiting list is opened and closed, and a lot of changes happen during that time. So we're not sure of how people have moved, or what their housing conditions have been, or what changes before they're able to get on the waiting list. And so that's also something that intrigues me with whichever community they end up with, like what changes happened during that time. I think one thing that I'm very much interested in, I think more people should look at, is the impact of rental assistance on children. And so sometimes some of the impacts we see are kind of like delayed, like we don't see immediate changes, but we've seen some research look at how it affects their education and their ability to stay in school. Some have found results in terms of incarceration in adulthood for children from supported homes compared to, kids who would have been eligible but didn't get, their families didn't have that opportunity, and also prospects of like economic mobility for those children as they grow into adulthood. And I think that's very interesting. One thing I also want to draw attention to is the people are finding racialized impacts, and sometimes with some families moving to some neighborhoods, the impacts are different. And so it's something that is more people are looking into, and I think we should pay more attention to in how we design the programs to make sure that people are moving to the communities that best suits their needs.
Actually, I could mention, since you mentioned mobility, I should mention that we've been involved in a couple of mobility studies. We were partners with Raj Chetty's team in studying the Creating Moves to Opportunity study in the Seattle area. And our team did a lot of the implementation research related to that study. And so if you're interested in understanding mobility programs, certainly the larger impact analysis of this mobility intervention and the implementation research will give you some great insights. We also launched a similar kind of study called supporting moves to opportunity in Milwaukee and St. Louis, which of course have very different local housing markets, the areas of historical hyper-segregation. And we'll be issuing some findings by early next year on the results of a randomized trial there, which pursue some of the same goals of trying to help families coming into the voucher program move to higher opportunity areas with this enhanced mobility support and guidance.
Do we have any parting thoughts from our panelists or any parting thoughts from our participants in this panel?
I would kind of like put a plug in here, sorry, and just make sure that I think that some of the numbers shared here, particularly in my presentation, kind of like can be discouraging. But at the same time, I think it's important to realize that we can't put a price on housing stability due to like its long-term impact. And so thinking about different ways to address that, from rental assistance to housing, affordable housing development, and all of that could kind of like bring in proper seeable results for communities and for the families that need the support the most. So
I'll just add that at the center, we're getting ready to release a publication that will be essentially a tool on ways that states and localities can create new dedicated revenue streams for housing and homelessness. And just the lasting thought I had is that revenue piece seems especially important right now, so that we can actually get some of these programs up and running and expanded, including direct rental assistance, including the Connecticut State Program, and so many other homelessness services and programs that would create like a really robust system at the state and local level.
Thank you, Irvi. Jim, do you have any parting thoughts?
No, I think I've indicated there's a range of research we've conducted, and would be happy to share more of it with anyone who's interested.
Well, on behalf of this entire panel, the panelists and the participants, appreciate everybody being on today, this afternoon, giving us part of your days to talk about these really important issues. I'll turn it back over to Chelsea at this point. And again, thank you from the Department of Housing. Thank you for everybody that's been on this panel. I think it's been very, very informative.